This is NAFDAC and Your Health, where we intimate you on the activities of NAFDAC, which is geared towards safeguarding the health of Nigerians. We also give you updates on how to patronize only wholesome food products and drugs, and hints on how to stay healthy. I am your regular host, Amanda Ugo.
On this edition of NAFDAC and Your Health, first we bring you reports on the press conference held recently where the Director-General of NAFDAC addressed newsmen on the trajectory that led to the court ruling on the relocation of open market drug sellers in Kano and the enforcement steps of the agency to see to the actualization of the relocation of the drug sellers to the coordinated wholesale center in the state. And in the second segment, we intimate you on how decentralized NAFDAC's operations are and the arduous work going on in the zones. The fight against substandard and falsified drugs in Nigeria has in recent times been on the front burner, particularly because of NAFDAC's enforcement drive to make the open market drug dealers in Kano State to relocate to the coordinated wholesale center in the Dangwaru center of the state. A court judgment has ruled in favor of NAFDAC after a 10-year-long legal tussle as instituted by the open market drug dealers who were in resistance of the relocation order. Comments have trailed NAFDAC's enforcement action after the judgment. It was to clear the air and give clarifications that the Director-General of NAFDAC, in the agency's usual manner, held a press conference with members of the fourth estate of the realm recently.
This morning is about continued fight against substandard falsified medicines. It's about safeguarding the health of our people in Nigeria, but in particular, it's about the relocation of open drug marketers to coordinated wholesale center in Kano. The chaotic drug distribution system in Nigeria has been a sore point to drug regulatory agencies, especially NAFDAC. This disorderly chain of movement of medicines in the supply chain from the manufacturer to the final consumer is inimical to the efficacy of pharmaceutical products and is the primary cause of substandard falsified medicines. In many climes all over the world, you don't have open drug markets. But in Nigeria, we have it, we have to live with it, but we have to monitor the marketers.
The NAFDAC DG gave an expose on how the coordinated wholesale center, where the open market drug sellers are being asked to relocate, came into being and its structure.
To eliminate substandard falsified medicines, the Presidential Committee on Pharmaceutical Sector Reform that was constituted in 2003 to, among others, to develop strategies towards the sanitization of drug distribution system in Nigeria. The Coordinated Wholesale Center is a product of this Presidential Committee. The coordinating Minister of Health and Social Welfare, Professor Ali Pate, is one of the architects of the CWC and is in full support of these coordinated centers. The Presidential Committee recommended the development of national drug distribution guidelines as a key strategy to coordinate the drug distribution subsector and all operators in the open drug markets in Kano, Lagos, Onitsha, and Aba. And these open drug marketers were given December 2018 deadline by the then Minister, Dr. Adeyeye, to relocate to the coordinated center. The National Distribution Guidelines gives a clear mandate to the regulatory agencies, the Pharmacy Council of Nigeria and NAFDAC, to ensure its full implementation and compliance by all concerned stakeholders. Pharmacy Council of Nigeria and NAFDAC were given mandate to ensure the full implementation of relocation of open drug marketers to the coordinated centers. The CWC in Kano was the first to be built as part of ensuring proper regulation of drug distribution and sale in Nigeria and mitigation of substandard falsified medicines. NAFDAC and Pharmacy Council of Nigeria, PCN, are the two regulatory agencies mandated to regulate the distribution and sale of drugs in the country. The two agencies have offices in that drug mall or CWC in Kano.
The refusal of the open market drug dealers has made them to institute litigation against NAFDAC and other relevant stakeholders supporting the relocation bid, and NAFDAC's victory at the court after the long legal battle has seen the enforcement team of the regulatory agency. The enforcement drive has, however, elicited reactions from the public, necessitating the need for the DG to address the press and clear the air on misconceptions surrounding the steps taken by NAFDAC.
Over the years, the medicine dealers in Kano have resisted all attempts by concerned regulatory authorities to relocate their pharmaceutical businesses from the open drug markets to from the open drug market in Mai Karami Plaza, Niger Street, Madam Kato and Sabongeri areas of Kano to the coordinated wholesale centers. We have 3 markets in Kano. And the wholesale center is in Dangwaro area of the city. The dealers even filed a suit in court seeking to reject relocation to the CWC. A landmark judgment was made by Justice Simon Amebeda in Kano Federal High Court on February 16, 2024, that ordered the open drug marketers in Kano to relocate their stores to the Dangwaro Coordinated Wholesale Center on Zaria Road. Sequel to this court ruling, NAFDAC, in conjunction with the Pharmacy Council of Nigeria, on the 17th and 18th of February 2024, embarked on an enforcement action to cause the relocation of the medicine dealers from the open drug market of Sabongeri, Madam Kato, and Mai Karami to the CWC. A total of 1,370 wholesale medicine outlets and packing stores were sealed in the 3 open drug markets. The owners of these outlets are from Monday the 19th, which was last week, February 2024, to relocate to the open drug markets, meaning reporting to the NAFDAC and PCN offices in that drug mall or the CWC. The judgment that the open drug marketers should move to Kano CWC is monumental, because the control of drug distribution will be better regulated and prevalence of substandard medicines, substandard and falsified medicines will be mitigated significantly.
According to the Director-General of NAFDAC, the drive to mitigate the menace of substandard and falsified drugs began since the inception of her administration.
Since the beginning of my tenure in 2017, the drive to mitigate substandard falsified medicines is one of the 8 pillars of my administration, and the efforts that have been made led NAFDAC to the attainment of maturity level 3. And it is not only NAFDAC that participated in that 4-year exercise. PCN also participated. Out of the 8 modules, NAFDAC has 7 modules. PCN, Pharmacy Council of Nigeria, has 1, which is the site inspection module. The continued fight against substandard falsified medicines is a fight to make our citizens healthier. And this has been blessed by this judgment that took place February 16, 2024. It is most significant for both NAFDAC and PCN because it shows a resolve of the 2 agencies to get rid of substandard falsified medicines in our markets and sets a good pathway toward attainment of maturity level 4. We are not stopping at level 3, we are going to maturity level 4. And part of it is making sure that our drug distribution supply chain is better sanitized.
Professor Mojisola Adeyeye, however, seized the opportunity to alert open market drug dealers in other big cities in the country to be prepared to relocate their businesses to coordinated wholesale centers in their locations.
Please stay tuned. The program continues after the break.
NAFDAC has observed with dismay the wanton illegality of unlicensed vendors peddling drugs to unsuspecting members of the public, despite efforts aimed at tackling the menace of drug hawking. NAFDAC hereby advises the general public to desist from buying drugs from these merchants of death. Drugs sold by hawkers are fake, counterfeit, and substandard. The hawkers expose the drugs to inclement weather, which degrades their active ingredients since they are stored in conditions that render drugs poisonous. The drugs could therefore damage the liver and kidney or lead to the death of the consumer. Drug hawkers constitute a threat to our national security. Hawking of drug is one of the main causes of drug abuse as victims continue to fetch drugs from unregistered and unregulated hawkers. Consequently, drug abusers soon succumb to the dilemma of depression, personality disorders, suicidal thoughts, mental disorder, sleep problems, organ failure, damaged immune system, memory loss, anxiety, social and economic problems. NAFDAC hereby warns those involved in the nefarious act of hawking drugs to desist from this illegal act or face the wrath of the law. NAFDAC, safeguarding the health of the nation.
Welcome back and thank you for staying tuned to NAFDAC and your health.
NAFDAC's operations are highly decentralized to ensure that the agency is close to every part of the country and that the agency's offices are easily accessible. Apart from having offices in all the 36 states of the country, NAFDAC also has zonal offices in all the geopolitical zones for effective operation. This helps to enhance the delivery of quality regulatory services to the Nigerian people. Mrs. Mojisola Adeyeye is the Zonal Director of the Southwest Zone of the agency.
We did some routine inspections in some states and we discovered that there are lots of violations, some unsatisfactory good manufacturing practice, because the condition for your registration is that your manufacturing practice is satisfactory. So by the time we visit again and we discover that it's poor, so we have so many poor or unsatisfactory good manufacturing practice. And of course, I raised an alarm and reported to the DG that this is the challenge. And so she approved and said, okay, raise a task force that will go around the states of the zone and see the prevalence of some of these issues that I was describing. And of course, we began from one of the states, and it was quite alarming, the level of violations. So the zonal task force is that, yes, each state has it's part of the function in each state to do routine, to do post-market surveillance. But sometimes, when you are too familiar, people are too familiar with you, you can hardly conduct enforcement. So we raise people from the zone to join people from those states to go about to visit these facilities with a third eye. Because somebody going to the same place every time, again and again, may not be able to, spot out the differences again, especially when there are violations. And of course, for security reasons, they will say, oh, this is the person that came to my facility. We are living in the same community. So when we suspect high level of violation, it's better that we raise task force from a different location where these people are not known. They are not known. They cannot. I'm not saying they can't be induced, but inducement is quite, not going to be very common. So we raise people from the zone to join members of the team in that state to go about and conduct this exercise, visit especially the registered facilities.
As so much work go on in the Southwest Zone, the director of the North Central Zone is also not resting on his oars in the zone that comprises states like Benue, Nasarawa, Kogi, Kwara, Plateau, and Niger.
About the expired products that we reported, and the products that we got, we have somewhere from Niger and some other states, and they were found in the premises or in the supermarkets. Most of them were carbonated drinks, canned foods, which have expired, and some of them have even gone ahead to even change the dates of some of those products. What we did was to evacuate all of them, to our warehouse, and also sanction, the companies that were involved in that. We also have the drug aspect. In fact, on the drug aspect, that is where it's even more common. A product will have expired, they will change the date. They have all these laser machines now that they use to reprint some of those things. So we also have those things. We have some other products that are unregistered, pharmaceutical and even food products. Some of them, are got under the pretext of global listing, and some of them under the drugs under the pretext of orphan drugs. These things are not excusable. The rules are very clear. If you need any of those things, you have the rules and you follow them. If you want to bring them for supermarkets, definitely there are the rules. If you want to bring them as orphan drugs because they are needed, the rules are there and they are not too stringent. Some fruits will be very red, ripened, but by the time you open it, you discover that the inside is not even ripe. Means they've used something external, which is usually carbon. So we actually have such cases. And in fact, in one of my operations in the past, in one of my locations, we even caught about 6 of them, which were televised.
The intention of our activities is not to kill businesses. The intention is to get people do what is right so that products offered to the public can be safe and wholesome and of the right quality. Under this current management, Professor Mojisola Adeyeye, the slogan of NAFDAC is customer-focused, agency-minded. If there are things that are not going to put the public at risk, the health of the public at risk, it is treated and sanction measures will be taken and corrections will be effected, and then the business gets going.
The National Agency for Food and Drug Administration and Control, NAFDAC, in a bid to improve on the audiovisual documentation of its activities and in order to capture very important moments, especially during its investigation and enforcement activities, recently procured cameras and other relevant media production equipment. To also ensure that these newly procured high-tech equipment are put to maximum use, the Public Relations Unit of the agency recently organized a training for the personnel of the agency from the Public Relations Unit and the Investigation and Enforcement Unit. The training covered both the theoretical and the technical aspects of production.
The PR department should also know that what are the information that are critical in this assignment that we are going for that must be showcased. So when you communicate that, you can itemize it. Sit down, itemize. This is what we need. Because this is what we want to. We don't want distraction. We don't want to say, show, we don't want to people to, I want, for example, I don't want people to vote. We are going for enforcement, for example, or we are prosecuting somebody who is doing illegal drug. And if we don't take control of that information, somebody can be watching a lady, maybe because that's what they are doing, a lady chewing gum in the video. Because the cameraman is showing, instead of focusing on who they are prosecuting, instead of doing, it's just panning, it's just going everywhere, it's just lousy, going everywhere. At the end of the day, what people will remember is one lady that is maybe, or a guy that is sleeping in the video or something. So little things like that can mark our attention.
With these steps taken to develop the capacity of NAFDAC staff in audiovisual recording, the trained staff will definitely take the audiovisual documentations of the agency to another level.
The person said, as we have seen now, we have come here to, and the shot is not showing what we have seen now. So who will, they said I will just do it. At times I see some of the visual, the person we're talking, we have done something. Television. It's radio that you'll be using your mouth to describe. Television should describe itself. In action.
The picture visual.
So it's a story, must tell story. The pictures must tell story.
That was NAFDAC Update. You have been updated.
We hope you enjoyed this edition of the program. Make it a date with us, same time, same station next week for another incisive edition. Meanwhile, we'll be glad to have you reach out to us if you have any information on activities that could mar the efforts of NAFDAC.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded.
Do not forget that it is illegal to import, produce, distribute, market or sell unwholesome food products, drugs, chemical, medical equipment or other regulated products that do not have the approval of NAFDAC or have expired. Be NAFDAC's partner in ensuring a healthy nation. Till we meet again next week, stay healthy.